Dr. James Whittaker.
Thank you, Dr. James Whittaker.
Thank you, Dr. Whittaker.
Thank you, Dr. James Whittaker.
Hello, I'm Dr. James Whittaker, and today I'm going to address one of the most controversial yet medically important topics that affects every man watching this video. Whether you're circumcised or not, what I'm about to reveal could have profound implications for your health, sexual function, and quality of life as you age. This isn't about religious or cultural preferences. This is about hard medical facts that most doctors are too uncomfortable to discuss openly. Last week, a 64-year-old patient named Robert came to see me with a problem that was destroying his confidence and his marriage. Robert had been experiencing recurring infections, painful irritation, and declining sexual function for over 2 years. 3 different doctors had prescribed antibiotics and creams, but nothing was providing lasting relief. What we discovered during his examination led to a conversation that completely changed Robert's understanding of his own anatomy and ultimately transformed his health and intimate life. What makes Robert's story so important is that it illustrates medical realities that affect millions of men over 50, yet these topics are rarely discussed openly. Whether you're circumcised or uncircumcised, there are specific health considerations, risks, and benefits that become increasingly important as you age. The decisions you make or don't make about these issues could significantly impact your health, sexual function, and overall quality of life for decades to come. Before I dive into the specific medical differences between circumcised and uncircumcised men, you need to understand why this topic is so rarely addressed properly in medical settings. Most doctors are uncomfortable discussing intimate anatomical details, and many lack comprehensive training in the specific health issues that affect men differently based on circumcision status. This medical silence is creating serious health problems for millions of men. Circumcised men may not understand certain health risks they face, while uncircumcised men may not be aware of specific hygiene and health maintenance requirements that become critical with age. Both groups are missing important information that could prevent serious health problems and improve their quality of life significantly. The truth is that circumcision status affects far more than just appearance. It impacts infection risk, sexual function, hygiene requirements, cancer risk, and even cardiovascular health in ways that most men never learn about. As men age, these differences become increasingly important, yet they're almost never discussed in routine medical care. What I'm about to share represents decades of clinical experience treating thousands of men, combined with the latest medical research that many healthcare providers haven't even seen yet. This information could literally save your life or dramatically improve your health and sexual function. Let me start by explaining the fundamental anatomical and physiological differences that create distinct health considerations for circumcised versus uncircumcised men, particularly as they age. For uncircumcised men, critical health factors. If you're uncircumcised, you have specific anatomical features that require particular attention and care as you age. The foreskin serves important protective and sensory functions, but it also creates unique health considerations that many men don't fully understand. The foreskin contains specialized nerve endings and maintains the sensitivity of the glands, head of the penis by keeping it protected and moist. This can contribute to enhanced sexual sensation and function when properly maintained. However, the foreskin also creates an environment that can harbor bacteria and other microorganisms if not properly cared for. As men age, several factors make foreskin-related health issues more common and potentially more serious. Decreased immune function. After age 50, immune system function naturally declines, making it harder for your body to fight off infections that can develop under the foreskin. Reduced mobility. Physical limitations or arthritis can make proper daily hygiene more challenging, leading to accumulation of bacteria and dead skin cells. Hormonal changes. Declining testosterone and other hormonal shifts can affect skin health and increase susceptibility to inflammation and infection. Medication effects. Many men over 50 take medications that can affect immune function, skin health, or circulation, potentially increasing infection risk. The most common health issues that uncircumcised men face include balanitis, inflammation of the glands, balanitis, inflammation of both the glands and foreskin, and phimosis, inability to retract the foreskin properly. Let me tell you about David, a 58-year-old uncircumcised patient who came to see me with recurring balanitis that was causing pain, discharge, and sexual dysfunction. David had been treating these episodes with over-the-counter medications, but they kept returning every few months. When we addressed his specific hygiene needs and implemented a comprehensive care protocol, David's infections stopped completely, and his sexual function improved dramatically. If you want to learn cutting-edge information about men's health that most doctors never discuss, make sure you subscribe to this channel right now and hit that notification bell. I share medically accurate, life-changing information every week that could transform your health and well-being. Also, let me know in the comments what country you're watching from. I'm seeing men from around the world dealing with these same issues, and understanding our global community helps me create better content for everyone. If you're circumcised, you may think you have fewer health concerns related to your anatomy, but there are specific issues that circumcised men face, particularly as they age, that most doctors never mention. Circumcision removes the protective foreskin, which means the glands is permanently exposed and can become less sensitive over time due to constant contact with clothing and exposure to air. This process, called keratinization, can affect sexual sensation and function as men age. Additionally, circumcised men face different risks and considerations. Increased susceptibility to injury. Without the protective foreskin, the exposed glands and shaft skin can be more prone to abrasions, especially during sexual activity. Different hygiene requirements. While daily cleaning is simpler, circumcised men need to be aware of different skincare needs and potential issues with scar tissue or adhesions from the original circumcision. Sexual function changes. Some research suggests that circumcised men may experience different patterns of sexual sensitivity and function changes as they age. Cosmetic concerns. As skin elasticity changes with age, some men develop concerns about the appearance of circumcision scars or skin irregularities. Thomas, a 62-year-old circumcised patient, came to see me concerned about declining sexual sensation and function. Thomas had assumed this was just normal aging, but when we evaluated his specific situation, we discovered that keratinization and some scar tissue issues were contributing significantly to his problems. After implementing targeted treatments, Thomas's sexual sensitivity and function improved substantially. One of the most significant health differences between circumcised and uncircumcised men involves infection risk, and the reality is more complex than most people understand. Research consistently shows that uncircumcised men have higher risk for certain infections, particularly urinary tract infections, sexually transmitted infections, and localized infections of the genital area. However, this increased risk is largely preventable with proper hygiene and care. The key factor is that the space under the foreskin can harbor bacteria, fungi, and other microorganisms that can cause problems if not properly managed. This is particularly true for older men whose immune systems may be compromised or who may have difficulty maintaining optimal hygiene due to physical limitations. However, it's crucial to understand that these risks are manageable. Men who maintain proper hygiene and follow appropriate care protocols can minimize these risks significantly. While circumcised men generally have lower rates of certain infections, they're not immune to genital health problems. Circumcised men can still develop bacterial or fungal infections, especially in the presence of conditions like diabetes or compromised immune function. Additionally, some studies suggest that circumcised men may have slightly higher risk for certain other health issues, though the research is still evolving. The important point is that both circumcised and uncircumcised men need to understand their specific risks and take appropriate preventive measures. Perhaps no aspect of the circumcision discussion is more important to men's quality of life than the impact on sexual function, yet this is rarely discussed openly or accurately. Research indicates that uncircumcised men typically retain more sensitivity in the glands throughout their lives because the foreskin protects these sensitive tissues from constant exposure and keratinization. This can translate to more intense sexual sensations and potentially easier arousal. However, some uncircumcised men may experience sensitivity that's too intense, leading to premature ejaculation or discomfort during sexual activity. The foreskin can also sometimes interfere with sensation or sexual function if it's too tight or if there are adhesions. Circumcised men often report different patterns of sexual response, with some research suggesting they may have better ejaculatory control, but potentially reduced sensitivity, especially as they age. Lubrication and comfort considerations. The foreskin serves as a natural lubricating mechanism during sexual activity, potentially making intercourse more comfortable for both partners. Circumcised men may require additional lubrication, especially as they age and natural lubrication decreases. Performance and satisfaction factors. Studies on sexual satisfaction show mixed results, with both circumcised and uncircumcised men reporting high levels of satisfaction when other health and relationship factors are optimal. The key seems to be understanding and optimizing your specific anatomy rather than the circumcision status itself. Michael, a 67-year-old uncircumcised patient, had been experiencing sexual difficulties due to foreskin tightness that developed with age. After addressing this issue with appropriate treatment, Michael's sexual function improved dramatically, and he reported higher satisfaction than he'd experienced in years. Take a moment now to leave a comment below. I want to know what specific questions you have about men's health as you age, and please mention what country you're watching from. Your engagement helps me understand what topics are most important to our global community, and it helps this vital health information reach more men who need it. One of the most serious health considerations related to circumcision status is cancer risk, particularly penile cancer, which, while rare, becomes more concerning as men age. Penile cancer is more common in uncircumcised men, with studies showing a 3 to 5 times higher risk compared to circumcised men. This increased risk is largely attributed to factors like HPV infection, poor hygiene, and chronic inflammation, all of which are more common in uncircumcised men but are largely preventable. However, it's crucial to understand that penile cancer is extremely rare in developed countries, regardless of circumcision status. The absolute risk remains very low, but the relative difference is significant enough that uncircumcised men should be particularly vigilant about hygiene and regular medical checkups. Human papillomavirus, HPV infection, which is linked to penile cancer, is more common in uncircumcised men. However, HPV vaccination and proper medical care can largely eliminate this risk difference. Other sexually transmitted infections also show different risk patterns based on circumcision status, with uncircumcised men generally showing higher transmission and infection rates for several STIs. Regardless of circumcision status, men over 50 should have regular examinations of their genital area and report any unusual changes, growths, or persistent irritation to their healthcare provider immediately. For uncircumcised men, this is particularly important because early signs of problems can be hidden under the foreskin if proper hygiene isn't maintained. Now let me give you the specific hygiene and care protocols that can prevent the vast majority of health problems related to circumcision status. For uncircumcised men, daily gentle retraction and cleaning of the foreskin with warm water and mild unscented soap is essential. Avoid harsh soaps or excessive scrubbing, which can cause irritation and actually increase infection risk. After cleaning, ensure the foreskin is completely dry before allowing it to return to its normal position. Moisture trapped under the foreskin is a primary cause of bacterial and fungal infections. Weekly, more thorough cleaning with attention to removing any buildup of smegma, natural oils and dead skin cells, is important for preventing more serious problems. Monthly self-examination for any unusual odors, discharge, pain, or changes in appearance should become routine, especially for men over 50. For circumcised men, daily washing with mild soap and water, paying particular attention to the area around the circumcision scar and any skin folds or irregularities. Regular use of appropriate moisturizers to prevent excessive dryness and cracking, which can lead to infections or other complications. Attention to any changes in sensitivity, appearance, or comfort during sexual activity, as these can indicate developing problems that are easily treated if caught early. There are specific situations where men should seek immediate medical attention, regardless of circumcision status. For all men, persistent pain, discharge, or unusual odor, Any growths, lesions, or changes in skin appearance, difficulty urinating or changes in urination patterns, persistent irritation that doesn't respond to improved hygiene, any concerns about sexual function changes. Specific to uncircumcised men, inability to retract the foreskin, phimosis, inability to return the foreskin to normal position after retraction, paraphimosis, recurring infections despite proper hygiene, any signs of chronic inflammation, specific to circumcised men, problems with scar tissue or adhesions, significant changes in sensitivity or sexual function, skin breakdown or persistent irritation around the circumcision site. One topic that many men are curious about but rarely discuss is adult circumcision, the possibility of having the procedure done later in life to address health or quality of life issues. Adult circumcision is a legitimate medical option for men experiencing recurring infections, phimosis, or other foreskin-related problems that significantly impact their health or quality of life. The procedure in adults is more complex than in infants, but it's safe and effective when performed by experienced urologists. Robert, the patient I mentioned at the beginning, ultimately chose adult circumcision after experiencing recurring infections that couldn't be controlled with conservative management. His recovery was smooth, his infections stopped completely, and his sexual function actually improved compared to before his problems began. However, adult circumcision isn't right for everyone, and the decision should be made carefully with comprehensive medical evaluation and counseling about risks, benefits, and alternatives. An often overlooked aspect of circumcision-related health issues is their impact on intimate relationships. Both circumcised and uncircumcised men may face relationship challenges related to their anatomy, especially when health problems develop. Partners may be concerned about infection transmission, changes in sexual sensation or satisfaction, or aesthetic preferences. Open communication about these concerns is crucial for maintaining healthy, intimate relationships. Some research suggests that partners of uncircumcised men may have slightly higher risks for certain infections, particularly UTIs, making proper hygiene even more important for relationship health. Conversely, partners of circumcised men may need to adjust to different lubrication needs or sensitivity patterns. The key is understanding that with proper care and communication, men of both circumcision statuses can maintain excellent sexual health and satisfying intimate relationships throughout their lives. Based on everything we've discussed, here's how to develop a personalized health strategy based on your circumcision status. Step 1. Know your anatomy. Understand the specific features and requirements of your anatomy. Many men have never received proper education about their own bodies. Step 2. Establish proper hygiene protocols. Implement the daily and weekly hygiene routines appropriate for your situation. This is the foundation of preventing most problems. Step 3. Regular self-examination. Develop a routine for monitoring your genital health and recognizing early signs of potential problems. Step 4. Professional medical care. Establish a relationship with a healthcare provider who is comfortable discussing these issues and can provide appropriate preventive care and treatment when needed. Step 5. Partner communication. Maintain open communication with intimate partners about health concerns, hygiene practices, and any changes that might affect your relationship. As we conclude this comprehensive discussion, I want you to understand that whether you're circumcised or uncircumcised, you can maintain excellent genital health and sexual function throughout your life with the right knowledge and care. The key is understanding your specific anatomy, following appropriate care protocols, and seeking medical attention when needed. Neither circumcision status is inherently better or worse. They simply require different approaches to optimal health maintenance. Robert's story, which began with embarrassing infections and sexual dysfunction, ended with him achieving better genital health than he'd had in decades. The knowledge and protocols I shared with him are the same ones I've shared with you today. Your circumcision status was determined long before you had any choice in the matter, but how you care for and maintain your health moving forward is entirely within your control. Don't let embarrassment or lack of information prevent you from achieving and maintaining optimal genital health. Whether you're dealing with current problems or simply want to prevent future issues, the information I've shared today provides you with the knowledge you need to make informed decisions about your health and work effectively with your healthcare providers. Your genital health is an important component of your overall health and quality of life. Take it seriously, treat it with appropriate care and attention, and don't hesitate to seek professional help when you need it. Thank you for watching this important discussion. I know these topics can be sensitive, but they're too important to ignore. Your health and well-being are worth having these conversations, and I'll continue to provide you with the medically accurate, comprehensive information you need to maintain optimal health throughout your life.